Bismillahirrahmanirrahim. Assalamu alaikum. Today, inshallah, we will talk about a new topic which is brachial plexus. First of all, we will see the functions of the brachial plexus. It provides sensory innervation to the skin and the deep structures such as joints. It provides the motor innervation to the muscles. It influences over the diameter of the blood vessels by the sympathetic vasomotor nerves. It provides the sympathetic secretomotor supply to the sweat glands. Now we will see that how the brachial plexus is formed. The brachial plexus is formed in the posterior triangle of the neck by the union of the anterior rami of the 5th, 6th, 7th, 8th cervical and 1st thoracic nerve. So C5, C6, C7, C8 and T1 are involved in the formation of the brachial plexus. The plexus can be divided into roots, the trunks, divisions, cords and the main branches. First of all, we will see that how the trunks are formed. The roots of the C5 and C6, they unite together to form the upper trunk. Then the root C7, it continues as the middle trunk. Then the roots of C8 and T1, they unite to form the lower trunk. In this form, three trunks are formed, upper, middle and lower trunk. Then the divisions will be formed from these trunks. Each trunk will divide into anterior and posterior division. See here, this is the anterior division of the upper trunk and the posterior division of the upper trunk. This is the anterior division of the middle trunk and the posterior division of the middle trunk. Then here, this will be the posterior division of the lower trunk and the anterior division of the lower trunk. So these are the anterior and the posterior divisions of the upper, middle and the lower trunks. Then the cords will be formed from these divisions. The anterior division of upper and middle trunk, they will unite to form the lateral cord. Then the anterior division of the lower trunk, see here, this is the anterior division of the lower trunk. It will be continued as the medial cord. This is the medial cord. Then the posterior divisions of all three trunks, they unite together to form the posterior cord. See here, this is the posterior division of the upper trunk. This is the posterior division of the middle trunk. And this is the posterior division of the lower trunk. They form the posterior cord. This is the posterior cord. Then there will be many branches. See here, there are many branches from the trunks, from the cords, and some branches from the roots also. The plexus as a whole occupies a cervico-brachial position. That is, it lies in the neck because cervico means neck and brachial means arm. So it lies within the neck and the upper limb. The clavicle overlies the plexus in such a way that it effectively divides the brachial plexus into upper supraclavicular part and the lower infraclavicular part. The roots, trunks and divisions of the brachial plexus, they reside in the upper portion and in the lower part of the posterior triangle of the neck. See here, this is the lower part of the posterior triangle of the neck. Here the roots, the trunks and the divisions of the brachial plexus are present. The three cords, they are located in the infraclavicular region. See here, this is infraclavicular part because it is below the clavicle. Here three cords are present, okay, in the axilla, where they become arranged around the axillary artery. See here, these are the three cords of the brachial plexus and they will be arranged according to the axillary artery in the axilla. Here the brachial plexus and the axillary artery and vein, they are enclosed together in a connective tissue wrapping which is termed as the axillary sheath, because in the axilla there is one sheath which encloses the cords of the brachial plexus and the axillary artery and the axillary vein. Now we will see some of the branches of the brachial plexus. First of all, from the roots, two branches come out. One is dorsal scapular nerve, which comes out only from the C5. See here, this is C5 and from this root, the dorsal scapular nerve will come out. Then there is a nerve which is coming out from C5, C6 and C7. This is named as long thoracic nerve. This is long thoracic nerve. So two branches from the roots are present. One is dorsal scapular nerve, which comes only from the C5, and one is long thoracic nerve, which comes out from C5, C6 and C7. Then from the upper trunk, see here, this is the upper trunk. From the upper trunk, two branches will come out. One branch is named as nerve to the subclavius. It comes out from the upper trunk, so it is named coming out from C5 and C6, okay, because upper trunk is formed by the C5 and C6. So this is nerve to the subclavius. Then there is another nerve from the upper trunk which is named as suprascapular nerve. Suprascapular nerve supplies the supraspinatus and the infraspinatus muscle. Okay, this is suprascapular nerve. Then from the lateral cord, many branches will come out which are named as lateral pectoral nerve. This is lateral pectoral nerve. Okay, then the musculocutaneous nerve. This is musculocutaneous. Then there will be the lateral root of the median nerve. This is the lateral root of the median nerve which is coming out from the lateral cord. Then from the medial cord, many branches will come out. First of all is the medial pectoral nerve. This is medial pectoral nerve. Then the medial cutaneous nerve of the arm. Then there is the medial cutaneous nerve of the forearm. Then there is the ulnar nerve and the medial root of the median nerve, because the median nerve has two roots, one coming from the lateral cord and one coming from the medial cord. Lateral root from the lateral cord and medial root from the medial cord. Okay, so these are 5 branches which are coming out from the medial cord. One is medial pectoral, one is medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, ulnar nerve and the medial root of the median nerve. Then we will see the branches from the posterior cord. See here, this is posterior cord and there are many branches which are coming out from it. First of all, upper and the lower subscapular nerve. This is upper subscapular and this is lower subscapular nerve. Then there is the thoracodorsal nerve. This is thoracodorsal. This is axillary nerve, and then the radial nerve, which is the main biggest branch of the posterior cord. This is the radial nerve. Okay, radial nerve, axillary nerve, thoracodorsal, upper subscapular, lower subscapular. These are the nerves or the branches from the posterior cord. This is the chart in which all branches are written. See here, branches from the roots are 2, which are dorsal scapular nerve and the long thoracic nerve. And in this column, all muscles are written which are supplied by these nerves. So dorsal scapular nerve supplies the rhomboids minor, rhomboids major and the levator scapulae muscle. The long thoracic nerve, which comes out from the root C5, C6 and C7, supplies the serratus anterior muscle. Then the nerves from the upper trunk are the suprascapular nerve, which supplies the supraspinatus and the infraspinatus muscle. The nerve to the subclavius will supply the subclavius muscle. Branches from the lateral cord are the lateral pectoral nerve from C5, C6 and C7. It supplies the pectoralis major muscle. Then the musculocutaneous nerve supplies the coracobrachialis, biceps brachii and the brachialis muscle. It provides the sensory nerve supply to the skin along the lateral border of the forearm when it becomes the lateral cutaneous nerve of the forearm. This point is very, very important because in exam they will ask you that the musculocutaneous nerve continues as the lateral cutaneous nerve of the forearm, not the arm, it is the forearm. So lateral cutaneous nerve of the forearm. Then there is another branch which is the lateral root of the median nerve. Okay, it will join with the medial root of the median nerve to form the median nerve, which will supply many muscles. Okay, then the branches from the posterior cord, it is the upper subscapular nerve, will supply the subscapularis muscle. Then the thoracodorsal nerve, which supplies the latissimus dorsi muscle, and the lower subscapular will supply the subscapularis and the teres major muscle. Axillary nerve will supply 2 muscles which are deltoid and teres minor muscle. Okay, and it will give the upper lateral cutaneous nerve of the arm, which supply the skin over the lateral lower half of the deltoid muscle. It is also very important that axillary nerve supplies 2 muscles which are deltoid and the teres minor muscle. And what is the sensory area, or what is the area of the skin which is supplied by the axillary nerve? It is the area of the lower half of the deltoid muscle. There the skin is supplied by the axillary nerve branch, which is the upper lateral cutaneous nerve of the arm. This is very, very important. Then the radial nerve, which comes out from C5, 6, 7, 8 and T1, it supplies many muscles because radial nerve is the main nerve of the posterior compartment of arm and forearm. So all muscles of the posterior compartment of arm and forearm are supplied by, and as well as of hand, they are supplied by the radial nerve, along with the skin on the lateral side of the dorsum of the hand and the dorsal surface of the lateral 3.5 fingers, and it gives the articular branches to the elbow joint, the wrist joint, and the hand, because it gives many articular branches, many sensory branches, and many motor branches because it supplies many muscles. Then the medial cord will give the medial pectoral nerve, which will supply the pectoralis major as well as the minor muscle. Then the medial cutaneous nerve of the arm, which is joined by the intercostal brachial nerve from the second intercostal nerve. This medial cutaneous nerve of the arm supplies the skin of the medial side of the arm. Then the medial cutaneous nerve of the forearm will supply the skin of the medial side of the forearm. The ulnar nerve, which comes out from C8 and T1, supplies many muscles, which are flexor carpi ulnaris muscle and the medial half of the flexor digitorum profundus muscle, flexor digiti minimi, opponens digiti minimi, abductor digiti minimi, adductor pollicis, third and the fourth lumbrical, introitiae, palmaris brevis, and the skin of the medial half of the dorsum of the hand and the palm, skin of the palmar and the dorsal surfaces of the medial 1.5 fingers. So it is very, very important that it supplies two muscles of the anterior compartment of the forearm, which are the flexor carpi ulnaris muscle and the medial half of the flexor digitorum profundus muscle. Then it will supply many hypothenar muscles, which are flexor digiti minimi, opponens digiti minimi, abductor digiti minimi, adductor pollicis is one of the muscle of the thenar side, and then the third and the fourth lumbrical, they are present on the hypothenar side, and all introitiae, the dorsal introitiae and the palmar introitiae, they are supplied by the ulnar nerve and the palmaris brevis muscle. Okay, so this is the muscle of the hand. Okay, this is also supplied by the ulnar nerve and many areas of the skin. Okay, then there is the medial root of the median nerve, which joins with the lateral root of the median nerve to form the median nerve. So this is from C5, C6, C7, C8 and T1. This medial root will supply many muscles. Okay, and the medial root of the median nerve and the lateral root of the median nerve, when they join together to form the median nerve, they will supply the skin of the lateral half of the palm, and they will give the digital branches to the palmar surface of the lateral 3.5 fingers. It will also give articular branches to the elbow joint, to the wrist joint and the carpal joints. See here this diagram. This is C5 root, C6, C7, C8 and T1. These are the anterior rami of these cervical and thoracic nerve. These anterior rami, they will join together to form the trunks. C5 and C6 will join together to form the upper trunk. C7 will be continued as the middle trunk, and C8 and T1 will form the lower trunk. Then they will divide into anterior divisions and posterior divisions. The anterior division of the upper trunk and the middle trunk, they will form the lateral cord. Then the anterior division of the lower trunk will be continued as the medial cord, and the posterior division of all three trunks, they will unite together to form the posterior cord. So there are three cords, which are lateral cord and the posterior cord and the medial cord, and they will give many branches. You have to learn all branches. First of all, two branches from the roots, which are the dorsal scapular nerve and the long thoracic nerve. Then two branches from the upper trunk, which are suprascapular nerve and nerve to the subclavius. Okay, then there are many other branches from the lateral cord, from the posterior cord and from the medial cord, which we have already learned. Again, this is the C5, C6, C7, C8 and T1. Okay, they are forming the trunks. These are the trunks which are formed by these roots. Then trunks will be divided into anterior and the posterior divisions. These divisions, they will unite together to form the cords, which are the lateral cord, the medial cord and the posterior cord, and then these cords will give many branches. Again, this is the same diagram which is shown here. Okay, the brachial plexus is present supraclavicular and infraclavicular. The cords are present infraclavicular, and they will be present along with the axillary artery and axillary vein in the axilla, and they are enclosed by the axillary sheath. This is again the same diagram, C5, C6, C7, C8 and T1, and they are forming the same structures which we have already learned. So these are many diagrams from which you can learn the brachial plexus very nicely. There is a traditional way to help how to remember the brachial plexus. So Robert Taylor drinks cold beer. Robert, so R for roots, Taylor, T for trunk, D for divisions, C for cords, and B for branches. Robert Taylor drinks cold beer. This is a mnemonic which you can learn for the brachial plexus. That first of all the roots are there, then they will form the trunks, they will give the divisions, and the divisions are united to form the cords, and the cords will give many branches. What are the terminal branches of the brachial plexus? The cords end by dividing into 5 terminal nerve branches. Number 1 is the musculocutaneous nerve. This is the lateral cord. It ends by forming the musculocutaneous nerve. Then the median nerve, which is formed by the lateral cord and the medial cord, because the lateral cord is giving the lateral root and the medial cord is giving the medial root of the median nerve. Then the medial cord ends by forming the ulnar nerve. The posterior cord will give 2 big branches. One is axillary nerve and the largest one is the radial nerve. So these are 5 terminal branches which are formed by the brachial plexus. Now some of the clinical applications. Axillary sheath and the brachial plexus nerve block. Because the axillary sheath, we know that it encloses the axillary vessels and the brachial plexus, a brachial plexus nerve block can easily be obtained. First of all, the position of the sheath can be verified by feeling the pulsation of the third part of the axillary artery. The distal part of the sheath is closed by the finger pressure. See here, the finger pressure is given to the distal part of the axillary sheath, and then a syringe needle is inserted into the proximal part of the sheath. The anesthetic solution is then injected into the sheath, and solution is massaged along the sheath to produce the nerve block. Okay, so in this way the brachial plexus nerve block is done. See here in this diagram, all the terminal branches are shown here. This is musculocutaneous nerve. Okay, then there will be ulnar nerve, median nerve, radial nerve, and there is axillary nerve which is present here. So these are the 5 branches which are the terminal branches of the brachial plexus. See here in this diagram, this is the diagram for the musculocutaneous nerve. It is formed by C5, C6 and C7. In axilla, it gives one branch which supplies the coracobrachialis muscle. In the upper arm, it gives branches to the biceps, the brachialis, and articular branch to the elbow joint. Okay, then in the forearm, it is continued as the lateral cutaneous nerve of the forearm. These are very good diagrams because these are the summaries of the main branches of the brachial plexus. So I have explained the musculocutaneous nerve. First of all, it is formed by C5, C6 and C7. In axilla, it gives a branch to the coracobrachialis. Okay, coracobrachialis is the muscle of the anterior compartment of arm. Okay, then the biceps and the brachialis, because musculocutaneous nerve is the main nerve of the anterior compartment of the arm. So it supplies 3 muscles here, coracobrachialis, biceps and brachialis. Then it supplies the elbow joint because it is crossing the elbow joint, so it will supply the elbow joint. And in forearm, it is continued as the lateral cutaneous nerve of the forearm, which will supply the skin of the lateral part of the forearm. Then the median nerve, it is formed by C5, C6, C7, C8 and T1. These are the root values which you have to learn. Median nerve does not have any branch in the axilla, which you have to learn, that median nerve does not have any branch in the axilla. Then in the upper arm also, it does not have any branch. Okay. Then in the forearm, it has many branches. First of all, it will supply the elbow joint. Okay, then it is the main nerve of the anterior compartment of the forearm. So many muscles are supplied by the median nerve here. For example, the pronator teres, the flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor pollicis longus and the lateral half of the flexor digitorum profundus and the pronator quadratus muscle. The superficial muscles and the deep muscles of the anterior compartment of forearm, they are supplied by the median nerve, okay, except two muscles only, which are the flexor digitorum profundus, the medial half, okay, and the flexor digitorum, one is flexor digitorum profundus and one more muscle, okay, flexor carpi ulnaris muscle, which is supplied by the ulnar nerve. Otherwise all muscles, they are supplied by the median nerve, okay. Then it will supply the wrist joint. See here, when it will cross the median nerve, it will supply the wrist joint. When comes in hand, it will supply three thenar muscles, okay, and the first two lumbricals, they are supplied by the median nerve. The medial two lumbricals are supplied by the ulnar nerve, okay, and then it is continued as a palmar cutaneous branch, okay, because it will give palmar cutaneous branch, it will supply the cutaneous area of the palm as well as the digits also, and which is area is the lateral 3.5 fingers and the lateral part of the palm. Okay, it will give palmar cutaneous branch and palmar digital branches to supply the lateral 3.5 fingers. Okay, the thumb, the index finger and the middle finger and half of the lateral part of the ring finger, they are supplied by the median nerve. Then the ulnar nerve, it is formed by C8 and T1. In axilla, it does not have any branch, and in the upper arm also. But in the forearm, it supplies two muscles. I have already told you, flexor carpi ulnaris and the flexor digitorum profundus, medial half. Then it will give the palmar cutaneous branch, and the palmar cutaneous branch will be continued in the palm. Okay, it will supply the skin of the medial side of the palm as well as dorsum of the hand and the medial 1.5 finger. Okay, only medial 1.5 finger is supplied by the ulnar nerve. Okay, it supplies the palmaris brevis muscle and the hypothenar eminence and the hypothenar muscles, which are adductor pollicis. Okay, adductor pollicis will be supplied by the ulnar nerve, but the hypothenar muscles are the antrochii, the third and the fourth lumbrical in the center, and all other hypothenar muscles, okay, are supplied. Adductor pollicis will come in the thenar, and the third and the fourth lumbrical comes in the center, and the antrochius muscle, they are also in the center, the palmar antrochii and the dorsal antrochii. So all these four muscles, they are supplied by the ulnar nerve in the hand, and the skin area is the medial 1.5 finger. The medial 1.5 finger, the palmar area as well as the dorsal area, they are supplied by the ulnar nerve. Now the axillary nerve, C5 and C6, okay, it is present in the axilla. Okay, it will cross the shoulder joint, so it will supply the shoulder joint also. It gives two branches, one is anterior branch and one is posterior branch. Okay, the anterior branch is supplying the scapular region and the skin over the lower half of the deltoid and supplies the deltoid also. It will and the posterior branch will supply the teres minor muscle and the upper lateral cutaneous nerve of the arm to the skin over the lower half of the deltoid. Okay, so anterior and the posterior branches, they will supply the skin over the lower half of the deltoid, and it supplies two muscles, one is deltoid and one is teres minor muscle. Now the radial nerve, it comes from C5, C6, C7, 8 and T1. It gives the posterior cutaneous nerve of arm in the arm. Okay, and in the, because it gives in the axilla, but it will supply the posterior cutaneous nerve of the arm, the posterior cutaneous area of the arm. Okay, then in the arm, it supplies the triceps muscle because it is the main nerve of the posterior compartment of arm and the posterior compartment of forearm. It supplies the brachialis also, a small part, the brachioradialis, the extensor carpi muscles and the elbow joint. Okay, it is giving the lower lateral cutaneous nerve of the arm also, and mainly the posterior cutaneous nerve of the forearm. In the forearm, it supplies many muscles which are present in the posterior compartment of the forearm. Okay, by giving a superficial branch which is sensory, and it supplies the lateral side of the dorsum of the hand and the lateral 3.5 fingers. See here, it supplies the lateral side of the dorsum of the hand and lateral 3.5 fingers. Okay, And the muscles which are present in the posterior compartment of the forearm are the supinator muscle, the extensor carpi radialis brevis, the extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, and extensor indicis. All these muscles, they are supplied by the radial nerve. So this is the summary. Roots has given dorsal scapular and the long thoracic. Upper trunk has given nerve to the subclavius and the suprascapular nerve, and the lateral cord has given the lateral pectoral, musculocutaneous nerve, lateral root of the median nerve. The medial cord has given the medial pectoral nerve, medial cutaneous nerve of the arm, and the medial cutaneous nerve of the forearm, the ulnar nerve, the medial root of the median nerve. The posterior cord has given the upper and the lower subscapular nerves, thoracodorsal nerve, axillary nerve, and the radial nerve.